Okay, good afternoon. My name is Tom Hudako. I'm with the Utah Department of Health. Wanted to give a quick rundown of the speakers that we'll be hearing from today. First will be Dr. Angela Dunn, who you all know is the state epidemiologist with the Utah Department of Health. Dr. Dunn will provide us with a daily situational report. Following Dr. Dunn will be Tracy Gruber. Tracy is the Director of Office of Child Care at the Department of Workforce Services and also a member of Lieutenant Governor's COVID-19 Task Force. Tracy will be here to talk about the launch of the Child Care Operations Grant that will help support Utah's child care programs. And following Tracy, we will hear from Kevin Burt. Kevin is the Unemployment Insurance Division Director, also at the Department of Workforce Services. Kevin will be here to talk about the pandemic unemployment assistance applications, those applications being made available to individuals who have lost work or wages and who do not qualify for traditional unemployment. So with that, I'll turn it over to Dr. Dunn.
All right, good afternoon. So we are now at 2,542 cases of COVID-19 in Utah. That's an increase of 130 from yesterday, or a 5% growth rate. We've tested 47,614 Utahns for COVID-19, an increase of 1,138 from yesterday. And there are national reports that have recently come out that put Utah in the top 10 of states for per capita testing. So we've tested 13,500 individuals per million in the state of Utah. And I really want to take this moment to thank all of our healthcare systems in this state for the time and energy that they've put in to getting people tested. We still have unmet capacity, and I've been focusing on this all week. Anybody with one of 6 symptoms should get tested for COVID-19. These 6 symptoms are fever, cough, shortness of breath, pain in your muscles, loss of taste or smell, or a sore throat. We are now up to 221 total hospitalizations. That's an increase of 8 from yesterday, and we do now have 20 deaths. We have 1 death to report today. It was a male Salt Lake County resident, greater than the age of 60, who passed away at a hospital and did have underlying conditions. I also want to report on some of our exposure data. That means, where people who have COVID-19 are getting the disease from. Of everybody we've investigated, we only have 15% of our cases where we haven't been able to identify where they got COVID-19 from. We call that community spread. 70% of our cases are a known contact to a confirmed case, 11% are travel associated, and 4% are healthcare associated. Think, our long-term care facility outbreaks. So the fact that we know where 85% of our cases were exposed to COVID-19 is a sign that the public health infrastructure is working. Our contact tracing, our active monitoring, and our case investigation are doing the job we want them to do. It also means that Utahns are following the governor's directive. They're staying home, they're having limited number of contacts, so that when public health reaches out to them, they know exactly who they've been into contact with and we can take the appropriate action. I know these measures can be tough to follow for the long term, and I just want to let people know that we need to keep this up. You're doing a great job, it's working, and it is helping to curb the spread of disease here in Utah. With that, I'll take some questions.
Great, thank you, Dr. Dunn. Kind of sticking to that point, in places like Southern Utah, where we're talking at this point maybe 55, 54 cases total, comparison to Salt Lake County, comparison to Summit County, a lot of people will say, there aren't this many cases here. Why are we taking such drastic steps? In comparison to Salt Lake, shouldn't there not be a one-size-fits-all? What would you say to that?
Our perspective for the state has definitely been that the governor expects everybody to be following his directive. It does allow those jurisdictions who want to go even further in their enforcement of the directive and enforcement of social distancing measures to do so based on their own individual situations. So I think that it is working. We have one directive for the entire state, and then jurisdictions are allowed to have stricter enforcement if that's what they think is appropriate for their jurisdictions.
Yeah, and just to follow up, in other words, should people still be cognizant in other places that may have not seen as big an effect as areas of
I see.
northern Utah?
Yeah, absolutely. I mean, the other side of the coin to that is that COVID-19 isn't going to stop at borders, and it's not going to stop at jurisdictional divides, right? And so a risk in Salt Lake City could certainly be a risk statewide as well. And so we want to make sure that everyone across the state is following the governor's directive, because that's what's ultimately going to make sure we see a downward trend in cases.
Hi, Dr. Dunn. Last week, I brought up a question about testing the workforce to determine who's healthy and bringing them back in, either placing them in a hotel or even potentially having them create bunks in their office to just get people back to work, but to ensure that people coming back to work, being together, are healthy. Has there been any talk since then about using that unmet testing capacity you brought up to facilitate a process like that? And then the other question I have is, I know there's a big push to get business back open. And a lot of the talk surrounds the fact that, well, most of the people dying from this are elderly, and we can just kind of have them stay at home and continue to self-isolate while we can get people back into the workplace. But taking a look at the hospitalizations, am I correct that most of the people being hospitalized are 25 to 44 years old? And so the concern is, if there's an early return, that I'm just wondering what your thoughts are on those hospitalizations in that 25 to 44 age group skyrocketing.
Sure. So to answer your last question first, you're exactly right. The more severe disease is in those over the age of 65. And we're saying severe disease, we're talking about death. You can certainly have really bad disease and poor outcomes in younger ages that might not necessarily lead to death. And we are seeing in Utah high hospitalization rates everywhere from 25 to 65 years old. So it's impacting all age groups in the adult age range. And to keep in mind that it's kind of the more mild symptoms, those people who don't need hospitalization, that are spreading it to more vulnerable that do need hospitalization. So I agree, we need to have a very high level of prudence when we're looking at opening up businesses to make sure that we're taking all the steps necessary to limit the spread of COVID-19 even further. To your first point, so yeah, we have this excess capacity for PCR testing or viral testing for people. We are looking at a lot of options to see how we can deliberately roll out more testing to give us the information we need to make good policy decisions. So ensuring that populations who are maybe in the more rural setting or haven't had access to testing are getting it, expanding those who are close contacts to getting tested. And then of course, what we're already doing is in specific investigations in high-risk settings like long-term care facilities or homeless shelters, we're testing everybody who works or lives there, regardless of symptoms, so that we can adequately identify the spread in those communities as well. So those discussions and actions and planning are definitely ongoing to make sure that we're using that testing capacity wisely.
All right, thank you.
Hi, Dr. Dunn. California has set 6 requirements before their stay-at-home order can be lifted. And I'm wondering if that's something that you've thought about. They need capacity to expand testing and track quarantine and isolation. They need to protect the state's most vulnerable. They need the ability of the hospitals and health systems to handle surges, engage researchers and academic partners to meet demand. They also need the ability for businesses and such to handle social distancing. And then the 6th one is they need to determine when to reinstitute certain measures, such as the stay-at-home order if necessary. Are those all things that Utah already has, or where are we at? Would we follow that?
Yep.
And again, kind of when could we expect things to reopen? And I know I threw a lot at you. I apologize.
That's okay. So yeah, all those points you mentioned are part of our planning for the Utah Leads 2.0 plan in terms of identifying specific metrics that allow us to slowly reopen the economy. And part of that planning is also identifying what guidance needs to be given to each specific business so that they can reopen and limit the spread of COVID-19, as well as kind of your last point, we need to have those kind of rebound metrics. So if we start seeing an increase in cases, what will our actions be then as well? So those are kind of in that final draft stage, and we'll be releasing them to the public shortly.
Hey, Dr. Dunn, I think that last question is a good segue into my question. So the city of Riverton is creating what they're calling an economic revival plan. It's kind of the first in the state with respect to a certain city. I just got off the phone with Riverton's mayor, who says that this will start on May 1st, which is when the governor's current stay-at-home directive ends. He told me that even if the directive is extended, that they're still going to go forward with this. Essentially what it is at Riverton Main Park, businesses can come set up with signs, people can drive through, anyone can come, not just Riverton residents. I'm being told it would be a contactless event where people would be encouraged to stay in their cars. And it's in an effort to try to get people back out and get these businesses that need support more support. So the question is there a risk to that from health officials, or is this something that would be encouraged?
Sure. I mean, this is the first time I'm hearing about the plan, so without knowing the full details, it's tough to comment on kind of the risk. But I encourage, all city officials to be working with their local health officials to determine exactly what you're talking about, kind of what are those metrics that we need to look at to determine if those types of activities are safe, and how do we make economic revival in the era of COVID when we're still seeing an increased number of cases every day? How do we make economic revival safe for Utahns? So I can't comment on that specifically just because I haven't seen it, but I do encourage them to work with their local health official.
Okay, thank you.
Hi, I wanted to ask about the timing of the 15% of cases that have unknown origin, the community spread cases. Have those been mostly in the later part of this spread or earlier on before these various social distancing measures were implemented? Did those cases develop, or apparently were they caught, I guess, early on or later?
Yeah, so we're still working on plotting out the trend line for this. We know, for example, that travel-associated percentages has dropped significantly since all the travel bans have come into place. We are still kind of holding steady throughout this outbreak on the community spread versus the known contact. But we're working on plotting that out with, exactly as you said, specific policy interventions so we can more accurately understand the impact.
And then following up on that, I guess, if the number of community spread cases has been consistent, doesn't that point to the likelihood of a number of undiagnosed cases?
Yeah, absolutely. I mean, we know there's undiagnosed cases out there. That's the nature of COVID-19. The fact that you could just have a mild cough and still have it means that people aren't going to be going to the physician and to the testing sites to get tested necessarily. So that's why we're really encouraging everybody with even the most mild of symptoms to get tested. But we're also doing active case finding for certain populations so that we can identify where the spread is in high-risk communities. So yeah, we know it's happening. The goal is to keep it minimal and then to also protect the high-risk populations.
Yeah, thanks. Can you envision a way to go back to holding like large sporting events or concerts in a safe way in the short term, like in the coming months? I'm not talking about like next year or anything, but in the coming months. And if so, how? How do we do that?
Exactly. Going back to that Utah Leads 2.0 plan, large events, entertainment events are considered, and we're working on a phased approach in terms of being able to open things safely and taking that into consideration with the data that we're seeing at the time as well. So we're working through that right now. We're hopeful that our data continues to show, a decline in our growth rate and then eventually an actual decline in cases. And those are going to be the key metrics we look at when we start talking about opening up kind of businesses and events more widely. So letting data drive our decisions is going to be really important. And then the specifics of those decisions are still in draft form. Okay, thank you very much.
Good afternoon. I'm Tracy Gruber with the Department of Workforce Services, the Director at the Office of Child Care. Today, we're here to announce the release of the Child Care Operations Grant through the Office of Child Care. Utah's child care system is critical to Utah's economy. It supports our workers who are continuing to go to work throughout this crisis, and it's going to be critical when people return to work when it's over. Unfortunately, Utah's childcare system has taken a significant hit during this period of time, not unlike the childcare programs nationally. In Utah, 38% of licensed childcare centers have been temporarily closed or have temporarily closed. 18% of Utah's licensed family programs have closed, and the state has temporarily lost over 13,000 childcare slots. The programs that are remaining open have lost significant enrollment as the schools remain closed, and these programs are struggling to remain open. Through the Lieutenant Governor's COVID-19 Child Care Task Force, a work group was established to support these child care programs that are remaining open. This work group included community partners, several child care providers, our office, the Office of Child Care, and Care About Child Care agencies throughout the state. And through that work group, the Child Care Operations Grant was developed and is being released today. The Operations Grant is available to child care programs in the state that are licensed and that are open and operating. The funding that will be provided through these operations grants will allow these programs to continue operations in the face of significant lost enrollment. The funds will help these programs pay rent, make payroll, purchase supplies, and meet the new health and safety requirements that programs remaining open must meet. We're hopeful that through these grants, programs that are open currently will remain open throughout this crisis and will be ready when Utah's economy returns to normal and gets back on track. Licensed child care programs that want to apply for this funding need to complete an agreement form that will be posted later today at the jobs.utah.gov website at the Department of Workforce Services. They'll receive the funding, which will be issued monthly until the state and workforce services determine that child care programs are able to return to normal operations. And with that, I'm happy to answer any questions.
Tracy, I'm wondering, this grant program, is it just for, say, brick and mortar childcare facilities, or do they also go to licensed daycare providers that just operate out of their house and don't really have, a staff to speak of?
Thanks for that question. It is for both licensed center programs and licensed family programs. So both entities will be able to apply. Like the centers, the family child care programs have also lost significant enrollment. So being able to purchase supplies and food for the kids that are remaining in care, they will also be able to access these grants.
And unfortunately, the licensed providers that have, say, gone out of business, do they qualify at all or not really?
So at this point, these grants are available for programs that are remaining open. We are very much aware of and working on a strategy for those programs that have temporarily closed during this. We understand that those programs are going to need support to reopen so that they can continue to have their children that were previously enrolled return to their care so that their parents can return to work.
Okay.
Thank you. Two questions here. First, on the aspect of these centers that are still open, a lot of people might not realize that there are certain centers still open. When they hear about a statewide directive for social distancing, they might not realize these centers are open. What assurances can you give for children's safety at these facilities? And as a follow-up, how can people find out which centers are open in their areas? Is there like a way to find out on the web or anything of that nature?
Yeah, thanks for the question. I'll answer your first question first. In terms of the safety requirements, we have been working very closely with the Department of Health and the epidemiology division to make sure that childcare programs that are open are implementing safety protocols that ensures proper safety and reduces the likelihood of COVID spread. So some of those requirements include taking temperatures when kids enter programs, limiting the number of people in and out of the programs, making sure that the number of children and caregivers in each classroom is extremely limited, so no more than 10. We are confident that the programs that are remaining open are implementing these safety protocols as they were required to do so when they were issued on March 25th. There are people in Utah who are continuing to work and who continue to need childcare, and we know childcare can be delivered safely, so we are continuing to operate in that way, understanding that social distancing is imperative at this time. Thank you.
Good afternoon, Kevin Burt with the Department of Workforce Services, the Director of Unemployment Insurance Division. Today we are happy to announce working with our Workforce Development Division, we have been able to release the Pandemic Unemployment Assistance application. It is currently available for people to apply. This is a program that is part of the CARES Act and is a program for individuals who are not traditionally eligible for unemployment insurance, such as those that are self-employed or gig economy workers. And so it's important now, there are two different unemployment insurance programs, and it's important that the people that have been impacted by COVID-19 and are unemployed apply through the right program. And so to help, for those, the traditional unemployment is for those that have been laid off, have been furloughed, or have their hours reduced, and are able and available and expected to return to the job or looking for a job. The pandemic unemployment assistance is for those that are self-employed or working in the gig economy. They lack the sufficient wages to be able to qualify for the traditional unemployment benefit, or they have been diagnosed with COVID-19. We've created some FAQs to be able to help with that. You can go to jobs.utah.gov/COVID-19 to be able to get to that information. A great tool also at the in the jobs.utah.gov homepage for unemployment assistance, there is an Am I Eligible button. If you click on that, you will enter your social security number. If it comes back with a monetary decision as eligible, then you should apply for the traditional unemployment benefit. If it shows that you are ineligible or $0, then pandemic unemployment assistance is the correct application. It's important to also understand that individuals that are determined eligible for pandemic unemployment assistance will also qualify for the additional $600 per week as part of the CARES Act. And those that have applied for unemployment or are receiving unemployment cannot apply for the pandemic unemployment assistance. It is not that you can get both. If you are eligible for unemployment insurance, then you are ineligible for pandemic unemployment assistance. And with that, we'll take any questions.
Kevin, is there anything that these people who qualify for the pandemic insurance, do they have to have some sort of proof that they've lost gigs or they're just not able to get any work because they are self-employed? I mean, how do they prove that they're eligible for it?
Well, with the self-employment, it is a little bit trickier, but the application is online. It has to be completed fully, and what they will have to do is provide some documentation uploaded, and that includes income received in 2019. As far as their impact and their inability to continue to work due to COVID-19, there is a self-certification piece to it. However, if an individual incorrectly reports that they are not working, that is considered fraud, and they will have to repay the benefits that they have received incorrectly. So it's very important that individuals that apply not only for pandemic unemployment assistance, but also for a traditional unemployment assistance, both of them have a weekly filing. In that weekly filing, you have a chance to attest, this is how much I earned this week, and that will prorate the benefit and ensure that there are not any issues with overpayments. Anybody that's reporting inaccurately, the department will pursue those overpayments and will collect those misappropriated funds.
Okay.
And what about in a scenario where you have someone who has, let's say, 2 or 3 part-time jobs? They've been laid off by 2 of them, but they can't claim unemployment because technically they still have 1 job, but that 1 job doesn't amount to much. What type of facilities are available for someone like that?
So if a person has a job and that makes them monetarily ineligible for unemployment, that they would also not be eligible for pandemic unemployment assistance because they are still working and still earning too much to qualify for the programs. The Department of Workforce Services also offers other assistance programs such as the SNAP benefit, medical assistance, or childcare that was just discussed to be able to help offset some or provide some assistance in other ways. But yes, if an individual is working full-time, lost a part-time job, but is still working full-time and just lost that supplemental income, pandemic...
No, I'm talking about a person who, because they're working 3 separate part-time jobs. That's how I meant to set it up.
Well, and that's okay. If in the end the part-time job makes them monetarily ineligible, then they would still be ineligible. But if a person went from 3 part-time jobs to 1 part-time job, the best place for them to apply would be through the traditional unemployment insurance and be looked at for eligibility for that program.
Last question, would they have to quit their last job, the remaining job they have, to qualify for that unemployment?
If a person quits a job, that makes them ineligible for the unemployment insurance benefit. So that is not the correct action for an individual to take if they are if they are trying to qualify for unemployment. Quitting is not the correct action to take.
But just one last thing. So if they had that remaining last job and it's hardly enough for them to get by and they've lost two of the other part-time jobs, could they still qualify for some type of unemployment and keep that remaining part-time job?
Yeah, in many instances, there are a lot of employers that have gone from, or claimants that have gone from full-time to seeing significant reduction in hours. And those individuals, in many instances, are eligible for unemployment. So I really think this scenario that we're talking about is a person that would be eligible for unemployment. What they would have to do is when they do their weekly claim, they would have to report the wages earned in that part-time job. The unemployment benefit would be prorated based on their earning income. And then if they are eligible for the unemployment benefit, they would also get the $600 stimulus as part of the CARES Act.
Thank you.
Thank you, Kevin. Quick question. I may have misheard this, but I do apologize if I did. But you mentioned 3 aspects who might be available for the pandemic assistance application. You said self-employed, those with a gig situation. You also mentioned, I think, those who have had COVID. Can you explain that a little bit more?
Yeah, and if you go to it's difficult to explain that the total number of people that are eligible for this new program. It is considered a pandemic unemployment assistance, but what it's essentially saying is that an individual that is ineligible for unemployment insurance, but has had their employment or are unemployed due to COVID-19, they could potentially be eligible for pandemic unemployment assistance. And specifically, the Act covers those that have been diagnosed with COVID-19. And so individuals that have been impacted by that, because it prevents them from working. And so pandemic unemployment assistance is a program that would be eligible for them. Pandemic unemployment assistance has a minimum payment amount, meaning if a person is monetarily ineligible because they haven't worked enough hours, currently in unemployment, that person would be denied. If they are monetarily ineligible for unemployment, they are encouraged to apply for pandemic unemployment assistance, because what that does is if they are still monetarily ineligible, pandemic provides a minimum payment, which is $213 plus the $600 stimulus. So it is intended as a federal program to help people who have the self-employed, the gig economy workers, people who are monetarily ineligible for unemployment, and people who have been diagnosed with COVID-19.
So yeah, so just to follow up really quick. So you also mentioned those who have lost their jobs because of the pandemic. So are we also referring to people who may not necessarily qualify for the regular unemployment, but let's say their restaurant is closed completely because of the pandemic?
Yeah, and it really depends on how the employer set it up. If the employer is paying the tax, they may be covered on, and most of their employees, when it comes to a restaurant, most employees would be covered under the tax and would be eligible for unemployment. Unemployment is a tax paid for by employers to cover employees that are laid off through no fault of their own. That tax is put into a trust fund and is only paid to workers that are eligible. The self-employed, the gig economy workers do not pay a tax, and so they are ineligible for unemployment regardless of what their earnings were or their loss of earnings. Pandemic unemployment assistance is a new program that's intended to help these individuals that have also lost employment due to COVID-19, but currently are not tax contributors to the traditional unemployment benefit.
Okay, thank you.
Okay, so, and again, it kind of goes back to what unemployment insurance is. Unemployment insurance and how it's funded. Unemployment insurance is not only the benefit side, we also are responsible for the tax and the collection of that tax and the managing of the unemployment insurance trust fund. So every quarter, employers report their wages, and with those wages, we determine a tax, and those employers pay that tax. It's deposited into the trust fund to cover workers who are employees of those employers. And so that is a state trust fund based on Utah employer taxes and can only be used for people who were laid off through no fault of their own. The self-employed do not contribute to that tax, and so they have not been able to access that state trust fund. What pandemic unemployment assistance does is it creates a federal program that is federally funded, and so it opens up the individuals who have not paid in and contributed to that tax, or have not worked with an employer that have contributed into that tax. And so it's a matter of the funding stream. The CARES Act has created it temporarily. It is a federal program administered at a state level. The state unemployment is administered at a state level using Utah tax dollars.
Yes. How is your office keeping up with this historic spike? For instance, how long is it taking on average for people to get their unemployment benefits?
Well, we've been proactively communicating the tradition, or the normal processing timeframes are about 21 days for an application to be able to be processed. We are processing on average about 21 to 30 days due to the high volume. We will have the numbers released tomorrow with our normal briefing at 9:30. The data will be released at 8 o'clock, and then I'll have my regular weekly briefing at 9:30. But as far as this, we have actually partnered with our Workforce Development Division, and they're going to be helping with the processing. And so the most important thing that a claimant can do to help is, as I've said in the past, is apply online, make sure that you complete the application fully, and then and there is not a need to contact us. If we have questions about your claim, we will contact you. And then you have to file your weekly claim to attest where you're at. This holds true for the pandemic unemployment assistance. However, we need to make sure, one additional step is make sure they apply at the right location. Workers should start with the pandemic unemployment application. And again, a great tool is the Am I Eligible? You just put in your social security number, it goes and it collects those wages. And if we have wages on file, it'll say, hey, you're eligible for, or you're potentially eligible for this amount. You should apply for unemployment insurance. If it comes back as 0, what that means is we have no employer reporting wages associated with you, and it's because you're self-employed. And so then you should be applying for pandemic unemployment assistance.
Got it. One more quick one. How do you define gig worker, and what are some of the more common examples of somebody who's a gig worker?
Well, self-employed individuals would be, it's 1099 workers, individuals who are due 1099s when they do their taxes. So common would be Uber or Lyft, or people who are self-employed, they're hairstylists, or there's some construction workers that are self-employed. And so if you are a 1099 worker, then that is a self-employed worker. But again, it can be confusing for the applicant, but you don't want to go through both applications. You should choose the correct one. So we do encourage the use of that "Am I eligible?" It's immediate and can provide that guidance of what is the best place for a claimant to start. And again, it has to have that the employment has been impacted due to COVID-19. If you are continuing to work full-time and you haven't seen any disruption with your self-employment or your regular employment, or you've been able to telework, or you're on paid leave, you are considered employed and you are ineligible for the benefits. It's for people who are unemployed or have had their employment interrupted due to COVID-19.
Okay, now you can hear me?
Yes.
Awesome. So I've been, a lot of Hispanic people are been asking, so I still in the process to obtain my papers, but I just lost my job here because the coronavirus. Is there any options for undocumented Hispanic people that's still in the process to obtain their papers?
So as part of the application, you will have to provide your alien number to be able to verify whether the applicant is eligible or not. And so that is true with pandemic and unemployment assistance. Keep in mind that the rules of unemployment assistance, the state unemployment assistance, are the same for pandemic unemployment assistance, other than it does cover individuals that haven't paid the tax because the funding is coming from the federal dollars, the federal stimulus dollars, rather than the state trust fund. So if a person is ineligible to apply for unemployment assistance because of their status, they would also be ineligible for the pandemic unemployment assistance. However, there are other programs that might be it could be of assistance to them. They should go on to jobs.utah.gov/COVID-19.
Thank you. Kevin, this is Michael Orton, and I'm just wondering if a typical unemployment benefit through the pandemic program would be going maybe to our large substitute teacher cadre within the state. There are a lot of them that were used to being able to work all the way through the school year, and many, of course, have summer employment options, but would this be appropriate for that group of people?
And again, I think that what we want to do is not try to understand the program and its complexity and prevent people from applying. In the end, if you go to the "Am I eligible?" and you have a monetary decision and your employment has been interrupted due to COVID-19, you should apply for unemployment assistance. If it comes back as 0 and your employment has been interrupted due to COVID-19, then and it comes back as $0 eligible, you should apply for pandemic unemployment assistance. What we want to do is make sure that the programs are available and continue to be able to process those, but it is not, so if you have lost employment, you should be applying for unemployment assistance regardless of where that loss of employment occurred. But if you continue to work, then then this program is not for you, and you have to report accurately. When you are doing your weekly filing, you have to report your earnings, wages earned, or it will create some issues for you in the future. It is not a supplemental. It is supposed to help with people who are unemployed.
Right. So just to clarify, the idea then in that case would be for those. I'm trying to understand the distinction because their workplace, in terms of teaching, for instance, was shut down because of the COVID response, and so you are then. You're then expecting them to go to regular unemployment and then also to see if they qualify for pandemic as well?
No, I'm not. So a person that is employed and has lost, they should go to the Am I Eligible button to make sure that they are an employer that is covered, or an employee that is covered because their employer paid taxes for them to be eligible for unemployment. They should not enter both doors. They should only apply for one of the benefits. The Am I Eligible button will help them decide the best door for them. In general, if you are a self-employed individual or are ineligible for traditional because you've been told you're ineligible or have been impacted by COVID-19, then you should be applying for pandemic unemployment assistance. However, if you have been furloughed, if you have been laid off, if you have had your hours reduced, then you should be applying for the traditional unemployment benefit.
Very well. Thank you for all of the information.
Yep. And with that, we'll end today's briefing.